Now that we have looked at color and the Vita Shade Guide, we are ready to start looking at how to shade match. Because women have more cones in their eyes than men do, we used to teach that women should choose the shade. But the latest evidence tells us that a man or a woman can choose the shade. From our textbook, gender should not be the criterion for choosing the person to perform shade matching. Now, people who are color deficient should be assisted when choosing the shade. No one is really color blind. Color deficiency is a weakness or absence in one or more cone systems. So, if this is what a non-color deficient individual would see, then this is what it would look like to a person who is missing green photoreceptors, red photoreceptors, or blue photoreceptors. These people should be assisted when selecting shade. Also, it's not clear in the literature whether the number of years in practice affects shade matching. Experience is relevant, but so is the status and age of the visual organ. So I might have a lot more years of experience selecting shades than you do, but your eyes are much younger than mine, so it might even out. Okay, so now here are some tips when selecting shade. First, as I have already stated, shade matching should be performed by individuals with normal color vision. Color deficient persons should be assisted. The tooth whose color is to be matched should be cleaned with pumice or toothpaste and rinsed. This was in your reading. The patient should remove all lipstick or should be asked not to wear lipstick because color around the teeth could change our perception of tooth shade. Both of these dots are exactly the same color, but they look different because of the background. So the background can change our perception of color, and that's why we don't want patients to wear lipstick when we are doing something involving shade matching. To avoid a mistake in shade matching due to eye fatigue of the dentist, the procedure should be performed at the beginning of the appointment. Of course, another good reason to choose the shade first is that the tooth will dry out and change in appearance as we start treating the patient. This was also in your reading. The tooth should be observed perpendicularly to its labial surface, with the eyes aligned at the same level as the teeth. Whenever possible, the shade tabs should be placed on the same plane with the tooth to be matched. Now that's easy to do if you have a space next to the tooth you want to match because you can place the tab between the teeth. But when the adjacent teeth are there, you have to do your best. One way to get the tab in the same plane as the tooth is to put the tab behind the tooth and angle it slightly. Look how different the same shade tab looks in these two photos. One exception to this rule would be a discolored tooth. You want to cover it with a shade tab so you can block out the discolored tooth so it doesn't influence you or distract you during shade selection. Here's the next tip. A single shade matching trial should last no more than 5 seconds at a time because the vision pigment is used up quickly during color perception. We used to recommend that you look at something blue between shade tabs, but that fatigues your blue cones. So the tooth and the tab will look more yellow. So now the recommendation is that a light gray card should be observed between shade tabs to neutralize your vision. Wetting the tooth with water can reduce or neutralize surface texture differences between the tab and the tooth, so that's another good tip. Here's another good one. The number of potential matches should be reduced as quickly as possible. These tabs should be separated from the other tabs before proceeding with the final shade matching. That will simplify the process quickly. As you already know, it is always good to verify the shade selection under different lights and at different angles to avoid or reduce metamerism, which occurs when one shade appears different under different lighting conditions. So choose the shade in your operatory and then bring your patient up to a window to double check the shade. As you saw in the color video, the human eye cannot see hue, value, and chroma separately. Humans can see differences in hue, value, and chroma, but these differences are dependent on one another. So here's an example from the Vita Shade Guide. B1 is considered to be the lightest shade in the system, but the A1 tab is actually lighter. It actually has a higher value than B, but it appears darker because it is more chromatic and it has a different hue. So the best shade matching advice is to simply select the best match. And once again, we should use the shade guide to select the shade that we think is the best, and then we should verify that by doing a mock-up on the tooth to confirm that shade.